just a quick note about something other than Canadian politics. Let's talk about American politics, even just for a moment. Back in 2009, Barack Obama nationalized U.S. healthcare. He brought 1/7 of the U.S. economy under government control. It was an odd thing to do, and he didn't campaign on it in 2008, but it was important to him. Obviously, he did this at great costs. Huge hikes in insurance premiums, and in some cases, strict rules limiting which doctors Americans can choose. It was awful from a patient's point of view, but in 2009, Obama told Congress that, quote, "There are now more than 30 million American citizens who cannot get coverage," unquote. That's why he was nationalizing it, to give them insurance coverage. By the way, just because you don't have insurance coverage doesn't mean you can't get health care, but that's a different point. That was the rationale, though. 30 million people needed insurance. But look at this news now. According to a new study by the nonpartisan Kaiser Family Foundation, quote, 32.3 million non-elderly people lacked health coverage in the U.S. So that's more. 1/6 of the economy was nationalized. The entire health insurance industry was destroyed, and with it, consumer choice. The doctor-patient relationship was replaced with a bureaucrat-patient relationship. And the whole excuse of the thing, the whole raison d'etre, insuring uninsured Americans, well, 5 years later, and the problem is actually worse. But you see, to Obama, this is not a disaster. It's a huge win. He got what he wanted, a large new government department, billions more in government spending, and the state injected into the private lives of every American. That wasn't just the process, it wasn't just the means to an end, it was the goal itself. And more than that, the fact that the problem of uninsured people is still a problem, and even worse, why, that means soon they'll need maybe Obamacare Part 2, or maybe it'll be called Hillary Care, or as we call it up here, Canadian-style taxes with Canadian-style medical waiting lists. For TheRebel.media, I'm Ezra Levant.